Good morning all. Myself Dr. K. Priyadeep Lakshmi, Assistant Professor from Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College, Salem. Today my lecture is on dental manpower. The contents: introduction, dental manpower in India, dentist, dental auxiliary. In that we are going to see definition, WHO classification, new auxiliary type, then degree of supervision of dental auxiliaries, followed by the conclusion. Introduction. India, with 1.3 billion population and projected to become the world's most populous country by 2025, faces the major public health problem as the dental diseases. The dental diseases, which includes dental caries, which has a prevalence rate of 60 to 65% of population being affected, 50% periodontal disease. So, efficient use of dental manpower is the need of the hour. Before going into detail into the dental manpower, first we have to know about the current scenario of dental manpower which is being in our country. So, the colleges, the number of UG colleges, that is BDS degree colleges, are 317 up to date, MDS colleges 277, followed by the DHDM colleges are 110, and PG diploma courses there are 8 colleges. Permitted seats per year for BDS, it is around 27,000 and 6,000 for MDS degree people. Current scenario, currently in India there are 370 dental colleges in the country. Presently most of India's dental colleges are private colleges, that is more than 80% of dental colleges are private. According to WHO, ideal dentist population ratio should be 1:7,500. India, as per 2004 statistics, there should be one dentist per 10,000 people in urban areas and one dentist in rural areas per 2.5 lakh people. So, there is a drastic difference between the two areas, urban and the rural population people. As per World Health Statistic 2014, the ratio should be 1:10,000, but as per National Health Portal Profile 2018, the ratio was around 1:10,271. Apart from this, in 1990, there were 3,000 registered hygienists and 5,000 laboratory technicians, implying that service of one hygienist was available to 7 dentists and 1 lab technician to 4 dentists. The first dental manpower which include is a dentist. Dentist is a person who is licensed to practice dentistry under the law of the appropriate state, provinces or territory or nation. To become licensed, he or she should have a completion of an approved period of professional education in an approved institution. Demonstration of competitions of skills should be there. Prevention and control of oral diseases and treatment of unfavorable conditions are the major key role for the dentist. So, dentists, they have a huge undergraduate courses and the postgraduate course. So, undergraduate course is for 4 years plus 1 year in an internship, followed by the MDS degree for 3 years. Moving into the next dental manpower, which include is the dental auxiliary. They have been defined as a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. Next, WHO classification of dental auxiliary, which was given in the year 1967. Non-operating auxiliaries, they have been broadly classified into non-operating auxiliaries and the operating auxiliaries. Under non-operating, again they have been classified clinical and laboratory. Clinical non-operating auxiliaries are the person who assists the dentist in his clinical work but does not carry out any independent procedures in the oral cavity. Whereas laboratory non-operating auxiliaries are person who assists the professional by carrying out certain technical laboratory procedures. Next, the operating auxiliaries, those are the person who, not being a professional, is permitted to carry out certain treatment procedures in the mouth under the direction and the supervision of the dentist. After this, there was a revised classification. Again, this has been broadly classified as a non-operating auxiliaries and the operating auxiliaries. Under non-operating, dental surgery assistant, dental secretary or receptionist, dental laboratory technician, dental health educator are included. Whereas in operating auxiliaries, school dental nurse, They have been also called as a New Zealand type dental therapist, dental hygienist, expanded function dental auxiliaries. Now we will see in detail each and every non-operating auxiliaries. First, the dental surgery assistant. These are the people, they have been also called as a dental assistant or a chairside assistant or a dental nurse. So these are the people who are a non-operating auxiliary but assist the dentist or dental hygienist in treating patients, but who is not legally permitted to treat patients independently. Before going into the duties of dental surgery assistant, we will see the past how these dental assistants have been evolved into the clinical practices. The first dental assistant was hired in the year 1885 by Dr. C. Edmund Kells of New Orleans. He hired a woman called as a lady in attendance so that female patients who needed dental treatment during this Victorian period times were made to feel at ease. Later, their degree of utilization was changed due to shortage of labor to meet the demands of the military services during World War II. These people were utilized. After, in 1960s, there was a marked change of both the dental auxiliary and the dentist to work in the operating field. There was an advent of four-handed sit-down dentistry. What is four-handed dentistry? This term is given to the art of seating both the dentist and the dental assistant in such a way that both are within easy reach of the patient's mouth. So there are two zones of activity, one for right-handed dentistry, other one for left-handed dentistry. In right-handed dentistry, there are four zones of activity. The first zone includes the operator zone, which is in the 7 to 12 o'clock position. Next is the transfer zone, 4 to 7 o'clock position. Assistant zone, 2 to 4 o'clock position, and static zone, 12 to 2 o'clock position. Transfer zone is where the instrument will be exchanged between the dentist and the assistant. Next, this zone of activity for left-handed dentistry. In left-handed dentistry, the operator zones it is in 12 to 5 o'clock position, whereas transfer zone 5 to 8 o'clock, and assistant zone 8 to 10 o'clock position, static zone 10 to 12 o'clock position. What is the duty of dental assistants? Reception of the patient, preparation of the patient for any treatment he or she may need, sterilization, care and preparation of the instruments, preparation and mixing of the materials, care of the patients after treatment, preparation of surgery for the next patient, presentation of documents and filling by the dentist, instructions to patients wherever it is necessary in correct use of toothbrush or any other oral hygiene instructions, assistance with X-ray work and processing and mounting of X-ray, after care of patients who had undergone GA procedures. Next, non-operating auxiliary is the dental secretary, or they have been also called as receptionist. These people are assist the dentist with his or her secretarial work and patient's receptionist duties. Next one, dental laboratory technician. They have been also called as dental mechanics. They are a non-operating auxiliary who fulfills the prescription provided by the dentist regarding the extraoral construction and repair of oral appliances and bridge work. Main duties of dental mechanics are casting of models from impression made by the dentist, fabrications of denture, splints, orthodontic appliances, inlays, crowns and special trays. As per DCA, their course period is of 2 academic years and candidates should have been at least 15 years of age and they should have passed at least matriculation examination, which they should have the science subject as a qualification. I am introducing another term called denturist. This term, a denturist, was applied to those dental laboratory technicians who are permitted in some states in the Denmark and Australia. In some countries, these dental lab technicians, they have been also called as denturists to fabricate dentures directly for patients without a dentist prescription. But in 1959, WHO Expert Committee on Auxiliary Dental Personnel has recommended that only qualified dentist may work directly on patients. Next, non-operating dental auxiliary is dental health educator. A person who instructs in the prevention of dental diseases and who may also be permitted to apply preventive agents intraorally. In Sweden, these people as a 2 additional weeks of training were given to them to conduct fluoride mouth rinsing programs to group of school children. Moving to operating auxiliaries, the first auxiliary we are going to see is school dental nurse. They have been also called as New Zealand type. These people is permitted to diagnose dental disease and to plan and carry out certain specified preventive and treatment measures, including some operative procedures in the treatment of dental caries and periodontal disease in defined groups of people, usually the school children. Why these people have been called as a New Zealand type? This dental nurse scheme was first established in 1921 in Wellington, New Zealand on army recruits by T.A. Hunter, and he also trained these people in the dominant school for dental nurses. Upon 2 years of completion of training, each school nurse is assigned to a school, and a school which has a 100 school children as a strength, they can have one dental clinic. So these people, dental nurse was employed by the government only to provide regular dental care of between 450 children in non-fluoridated areas and 700 children in fluoridated areas. The main duties of school dental nurse are oral examinations and prophylaxis, topical fluoride application, advice on dietary fluoride supplements, administration of local anesthesia and extraction of primary teeth, cavity preparation and placement of amalgam filling, pulp capping, patient instructions in tooth brushing and oral hygiene, classroom and parent-teacher dental health education, referral of patients to other private practitioners for more complex services. Next, dental therapist. A person who is permitted to carry out the prescription which was given by the supervising dentist, certain specified preventive and treatment measures, including the preparation of cavities and restoration of teeth. They are not permitted to diagnose and plan dental care. Their training period is for 2 years, and duties mainly they included clinical caries diagnosis, cavity preparation, deciduous and permanent teeth, vital pulpotomies and extraction of deciduous teeth. Dental hygienist. A dental hygienist is an operating auxiliary licensed and registered to practice dental hygiene under the law of the appropriate state, provinces, territory or nation. These dental hygienists work under the supervision of dentist. Dr. Alfred Frohns, who is called as the father of dental hygiene, he hired and trained Mrs. Irene Newen, the first dental hygienist, in his clinical practice. DCA is prescribed that course of dental hygienist includes 2 academic years and candidates should be at least 15 years of age, passed at least matriculation examination. The duties of dental hygienist: cleaning of mouths and teeth with particular attention to calculus and stains, topical application of fluorides, sealants and other prophylactic solutions, screening and referral, instruction in oral hygiene. In other countries where hygienists work are USA, UK, Canada, India, Nigeria, China, Japan, Korea and Poland. Expanded function dental auxiliary, or they have been also called as technotherapist, is a dental assistant or dental hygienist in some cases who had received further training in duties related to direct treatment of patients, though still working under the direct supervision of a dentist. They have been also called as expanded function dental hygienist, expanded function dental assistant. As I told you previously, technotherapist, they have been called in the country, in the place Philadelphia. The duties of expanded function dental auxiliary is placing and removal of rubber dams, placing and removal of temporary restoration, placing and removal of matrix bands, condensing and carving of amalgam restoration, finishing and polishing of restorations, taking of radiographs. Duties of EFDA in operating field. The expanded function dental auxiliary seats the patients they perform initial inspection and then with X-ray available calls for the dentist. The dentist further examines the patient, performs diagnosis and specifies a plan for the treatment. The dentist gives local anesthesia and prepare group of cavities, inserting pulp protection and cement bases. These people helps in a 400 relationship and thus sees and participates in all initial discussion and operation on the cases. The one more term I am going to include in dental auxiliaries, parenteral auxiliaries. In developed countries, dentists remain in urban centers and a large number of areas are too distant from public or private dental offices for the people to receive regular comprehensive care or emergency pain relief. Nurses and former dental assistant in such area can provide valuable services to these people with minimum of training. They can go for simple prophylaxis, basic dental health education, dental first aid and can be rendered for those with pain and subsequently they can be referred to nearby dentist. Moving to next part, there are apart from these operating and non-operating dental auxiliary, there are other new auxiliary types was formed by WHO Expert Committee on Auxiliary Dental Personnel. The two different auxiliaries are dental licentiate, dental aid. Dental licentiate, they will be given a training period for 2 years. They are semi-independent operator. They can perform duties like dental prophylaxis, cavity preparation, filling of primary and permanent teeth, extraction under local anesthesia, drainage of dental abscess, and early recognition of more serious condition. These people will be responsible for chief of regional or local health services. Dental aid, they will be given a training of for 4 to 6 months. A formal training will be given and they will be operating under supervision of the dentist. They can perform extraction under LA, control of hemorrhage, yearly recognition of the dental diseases. These people were useful in the countries where there were acute dentist shortage and where there were no facilities for training dentists. Finally, going for the degree of supervision of auxiliaries. So, most of the auxiliaries will be supervising by the dentist. The degree of supervision of auxiliaries which was given by ADA in 1975, there are 4 degrees of supervision. General supervision, the dentist has authorized the procedure and are being carried out in accordance to the diagnosis and treatment plan of the dentist. Indirect supervision, dentist will authorize the procedures and remains in the dental offices while the procedures are being performed. Direct supervision, dentist does the diagnosis of the condition, personally authorize the procedure and evaluates the performance before dismissal of the patient. Personal supervision, dentist is personally operating on a patient and authorizes the auxiliary to aid treatment by concurrently performing supporting procedures. To conclude, with rapid population growth and increasing demand for dental care, more and more dentists are required, but this is an expensive process. Hence, training an auxiliary is more economical, less time consuming and fewer burdens to society. This results in definite benefits to dentists, patients, auxiliaries and to whole community financially, psychologically and ethically. Thank you for watching the class.